Today's guest is Darren Ross, a physiotherapist, founder, and the brains behind Patient Notes. He's someone who knows firsthand how documentation can drain productivity and burn out healthcare professionals, but he's doing something about it. Through Patient Notes, Darren is building AI-powered tools that automate clinical note-taking for health professionals, freeing up time and mental energy so they can focus on patients, not paperwork. Let's learn more about it. Darren, welcome to ROI from AI.
Thank you for having me on. That's a very kind intro, and you look forward to our chat and exploring how AI has sort of, evolved over the last couple of years in healthcare. It's been a really crazy journey.
Yeah, I can imagine. And you've got that background in physiotherapy. That's sort of what led you to now working in tech and focusing on this clinical documentation. But what spurred on this pivot into something new?
Yeah, I've always had an interest in health tech in terms of really just solving issues at my clinics and their tech barriers that we're faced. Unfortunately, often in the healthcare space, we've been the poor cousins of really where tech has evolved to. So you'd get old technology and you'd end up with systems that would almost crash or just not keep going just in order to be doing the day-to-day function. So always had to have a bit of a sort of an interest in bringing new tech to our clinics, but also have done a few projects to Australia to just solve the common problem. I think that's where this always starts. If it solves a problem, then it's going to sort of be needed by many. In this particular case with the technology, I mean, AI is not new, as we know. It's very much the last couple of years. It's all the tip of everything from clinical systems like we're talking about to your cars and your fridges all have an AI. Golf clubs now have got an AI, sort of symbol on it. And you go, well, so AI is popular at the moment, but when it came to one of this situation is one of my physios was working over in the US and her husband was, I guess, at the forefront of AI for the last sort of 14, 15 years. And he saw the volume of notes that she had to do, the impact that had on family life, on stresses, and just said, I can solve this problem with where tech's at the moment. And he created a solution to solve his wife's problem of clinical notes. The long story is they came back to Australia very soon after and said, got me involved and said, what do you think? And I just said, this is going to solve, millions of practitioners' headaches because we're really good at our clinical side of things, but often note taking, you're on the spectrum in terms of you're either awesome at it, you're terrible at it, you're somewhere in between. And the problem lies is that if you're awesome at it, you're going to spend mega hours at it. If you're terrible at it, you're actually not going to be compliant and opening up medico-legal risks. And even that middle field was really sort of, we know that it took practitioners sort of 7 to minutes on average to do a consult note. For letters, it often can take 40 minutes. And in healthcare, we don't get paid for that. So they do it in their lunchtime. They do it in their evenings. They eat into it. They're too nice to people. So they'll always do these things, but at a price that was for the practitioner. So it evolved from solving a person's problem, one of my physios, someone's wife, and it's now rolled out beyond that.
Yeah, that's huge. You've definitely encountered a problem repeatedly and then took it upon yourself to make that change. Do you see that as a common barrier for people? Is maybe they're a bit too bogged down to implement something that would make them more productive?
That's something we hear all the time, and it's almost, you almost feel like reaching through the computer when you're doing a demo or a call or a pitch to a clinic as to why they might do it. They go, well, I'm reaching out to find a solution, but I'm too busy to actually look at integrating or trialing it. And you go, okay, so I can hear your problem. There's solutions available, but if you can't actually sort of look at how that's going to be effectively adopted or invest some time into it, then we're going to be having this conversation in 6, 12, 24 months. And we've seen that. We've seen users that have, they're beyond sort of stressed and they're reaching out, they're signing up for trials at 3 o'clock in the morning. They're overloaded, but they come back and they don't actually adopt it for 6 months and they go, man, I wish I had have done it earlier. But like anything, and I think this is where we're finding the adoption of AI in healthcare is that there's 3 real barriers as to whether it's going to work for them. One is making sure that if we are using what we call here ambient scribing, so we're listening to the consult in a secure and encrypted way, then we've got to make sure the audio is coming in well. Don't use a really poor $3 microphone from Timu or an example like that that is going to then, to try and capture a high quality console. Make sure you've got audio coming in. We had to then react to that. We created both a web platform, an iOS, and now an Android app because people are on the go and it needs to work asynchronously. It also needs to work across different mediums. But the smartphones are awesome at picking that up. Secondly, it needs to change the practitioner engagement. So many people would go, it's doing terrible notes. It's not doing the reports and letters. And you go, okay, let's look back in the transcript. And they sort of said, well, yeah, I was just saying, where does it hurt? And it hurts there and it hurts here. And you should do that. And they're not actually going into the clinical details. Okay, so on the right side of your neck, it's a little bit sore when you look around to there, or you're getting some right sided arm pain. Or, okay, if somebody shows you the medication, okay, so you're taking Panadol 3 times a day. You're taking these. So verbalizing, because the system is like a virtual assistant that can hear, but that isn't a clone of you. And then thirdly, there's the whole crazy world of prompts. And I think people use ChatGPT and they'll sort of assume that if they just throw this in, that it'll just miraculously give them an output. But there's a real science to getting the prompts to then craft the notes in the format, the style that we need or the practitioner needs. And practitioners have so many different nuances of how they want their notes and their reports. They're really precious about it. They're too time poor to do them, but they want them to be perfect. So sorry to digress, but they're the three big barriers that we've really found that we've had to break down. So we've actually found ourselves a tech firm, but also an education firm. We've had to take this education and empowerment along that journey because without that, people were just hitting a wall with AI and they were frustrated. They're going, it's either awesome or it's terrible, and somewhere in between.
Yeah, I guess there's a lot of work around converting people to wanting to implement AI. So I'd love to know what kind of ROI are you seeing from automating the clinical notes? You did touch on there's time saved, maybe there's more consultations happening. What are those key metrics for success?
Yeah, the biggest thing we look at is sort of twofold. It comes down to either the time to do their clinical notes, and we know that that is really a multiplier of around sort of 4 to 5 minutes per consult. So if somebody sees 10 patients a day, that's going to save them 40 to 50 minutes. So multiplying that across the day, the week, the month, we now know that that ROI pays for itself. Really, like the price of a the subscription will pay for itself probably within half a day of actually even working. So it's a quite a low cost there. For different reports, it could just be I'm writing a letter across to a medical team. I'm writing a letter across with to go to a surgeon, a GP, and those types of reports. Instead of sitting there whilst your GP does that, they're pretty much instantly created. The practitioner will screen over it. The screening will probably take a minute. So versus around sort of 8 to 10 minutes for a detailed letter to be written. For more complex reports, one example is that we support a lot of practitioners who do work in the NIS space. And often what they would do is they would do an hour consult and then 3 hour report building. We can build that report within 30 to 40 seconds. And then we now find that they'll often go through and edit that, and it'll take them around half an hour to then edit and get it to a deliverable sort of functionality. So you save 3 hours report down to probably 30 minutes. So that's the kind of a ratio that we tend to work off is sort of, really around a 1 in 5 time saving. And that across either the load of a practitioner, it could be that they either see more patients, just get to have time in the lunchroom or go home at work or don't have to work the weekends. So it can very easily, the ROI is the easiest thing to justify to organizations and practitioners.
It's kind of crazy that a benefit is just going home on time, which should be something that we all experience. So I'm sure you've seen so much change and transformation with some of these clinicians. Do you have a real world example or use case from someone that's adopted patient notes and has seen a lot of success?
Yeah, it's kind of topical that we're having this discussion. I just got an email last week, and as soon as I got the email, I had to reach out to this particular person. They're an overseas user and they're a podiatrist, and they said I've been using it for 6 months. Heard about it just from a friend, rolled it out. and it's been amazing from my clinical side of things. We said that's not the best thing. Like what I've then been able to do is I've actually now been able to, the time that I was doing my notes, staying around, doing all that, I've now been able to put into my interest in social media. And now he's become a real high influencer in the healthcare space. He said, I've got 500,000 followers now, and that wouldn't have happened without doing that. And that's part of my hustle, is that I'm now going to be doing that on as more of a full-time gig, still seeing patients, but it wouldn't have happened. And it was a really nice kind of story. I've got other anecdotes where you can sort of, be in the lunchroom and all those kind of things, but it really would hit home that I had that. And I just said, I've got to get on a Zoom call with him and just find out a bit more. So he was sort of quite emotional about this made this happen.
Yeah, that's beautiful. It's life-changing. You're actually using AI to make people more human. And it's one thing I've noticed across all of the guests we've had, is that AI can make us more creative and more artistic because we're taking away the need to do all these administrative tasks. The more productive we are, the more time we have to be ourselves. I think it's beautiful.
Yeah, absolutely. And I think the even better thing, like the reason I do it is, yes, it's great for helping fellow practitioners up. But my biggest value and purpose in doing this is that it actually can engage the patient, being the customer, a lot more in healthcare, which I think has been notoriously done bad, not for decades, like centuries. Like you go and see a doctor, you walk into the clinic, you go and have an examination, they'll do all these things. And then by the time you get to the car park, how frequently have you forgotten about what they've actually sort of said? So our system can deliver a summary of your session to you by the practitioner that says, okay, these are the things wrong with you, so that you don't get home and your head spinning and you then go to Dr. Google. You can actually factualize, this is a true representation of the consult. Here's your action plan. Here's what's going on. So that, I think, is the biggest power, because especially with AI, we're now finding that patients, before going to see doctors or therapists, are already doing their ChatGPT. I've got this pain, I've got this weird rash, I've got what's wrong with me, and it'll list everything from cancer to a mild sprain. And they're often, Dr. Google, we sort of say, can be great, but it can also be super dangerous. Whereas AI has great ability to do this administration purpose, but it never will have still the full clinical experience of an experienced practitioner. So you need to blend that together. And I think by harmonizing what real information comes to the client, to the patient, via a easy processing medium such as AI, with the practitioner's input, is where the real secret sauce comes out.
Yeah. So you've got this open feedback loop with your clients and with your clinicians. How are you balancing this feedback and then translating that into product innovation? Is it something that you're quite agile with and you're constantly updating patient notes? How does that process work
Oh,
for you?
yeah, our roadmap is scary. Like we're just iterating new features weekly. In fact, just got off a call there with probably the biggest thing we're going to be rolling out in the next couple of weeks. But I guess now, having set up practitioners of all different disciplines across all different continents now, we have found what works for someone hasn't worked for others. So we've had to be really, really flexible. Part of that is what we've engaged just recently, what's called hybrid notes. So not just relying on the ambient scribing, but also the ability where practitioners can engage with their own sort of interpretation, free text, adding in an additional post-consult audio to then give it more context, or even preload it. Just about to see Darren, this is what symptoms are going on. So then you can condition the session to then be able to optimize it from there. But I guess the biggest thing we've then done is sort of things like integrations, making sure that it connects with different sort of other functionalities, being able to then add in information such as radiology and pathology reports. So all those are some features that we've sort of iterated. One of the features we sort of listened to most recently too was we want to empower the practice managers and assistants that are happening in healthcare organizations. I hear every day, oh, AI is going to take away the reception job, the practice manager, the this and the that. And, I don't believe that's actually should be the case. I think clinics that are thinking that way are really taking the customer away from their focus. Instead, we release a role-based feature so that your assistants can actually help you with your notes. but or help you with your more detailed reports, rather than sort of necessarily just that trying to keep them out of the loop. Because in many cases, that human touch is the most important part of a person's visit to the doctor or the healthcare practitioners. But our roadmap moving forwards for the next 6 to 12 months, especially with the technology changing, is it's just so exciting. We've seen huge changes in what AI can do in the last sort of, in particular, 2 to 3 years. But now I think the next 6 to 12 months is where we're really talking about this Scribe 2.0, Scribe 3.0 version functionality. Rather than, we've done the proof of concept, we can do people's notes, but what next? And that's what we've got our team creating now.
Yeah, so patient notes is moving quickly because AI is moving very quickly. I would love to know from you, and you sort of touched on it there. Where do you see the AI space, particularly in healthcare, evolving over the next 5 to 10 years?
I think connectivity is really the key. Like we know that AI can process large volumes of data very, very quickly, but it doesn't have to just be data from an LLM. It can also be data from devices. Knowing that if you've got somebody coming in, they've got this little thing that measures so much for them during the day, preloading information about their healthcare to the consult so that practitioners are then educated. Connectivity with some systems, and I've been fortunate enough to do some work with the government with regard to the My Health Record. I think that is not where it needs to be for consumers at this point in time, and they reckon. And so, being how AI can bridge the gap between some of the practice softwares to then helping to interoperability with the key metrics that should be tracked as an individual consumer, being me, in terms of what's being stored, connectivity between scans, pathology results. So it becomes it formulates this synthesis of data collection that we can then use rather than just using it for a one-off consult. But there's lots of things there that have to happen with encryption and consistency of the information, protection of client data, which we're working on from the reverse end to make sure that we're prepared for this moving forwards as well.
Yeah, fantastic. Well, this is a business podcast, Darren. So we have to pivot to business, and this is a question that I ask all my guests. But I would love to know from you, what is your biggest tip for a return on investment using AI?
Biggest tip for return on investment, I think the biggest tip would be almost working on that happy staff environment. If I'm looking from an organization owner, nothing pleases me more than what I touched on briefly, getting people in their lunchroom, not doing their out of hour work, because that is where the burden strains on healthcare. We do know in professions such in most of the allied health, there's around a 50% dropout of that profession within 5 years. So people go on and train as a physiotherapist, train as a occupational therapist, and they're left the profession within 5 years. And one of the biggest reasons for that is the administration burn. So if we can keep the good practitioners in there that can not be overworked and not underpaid for what they're not remunerated for, but also give the opportunity for those real movers and shakers to leverage, to scale, to free up more diary time, increase your billings. It's a win-win across the board rather than some other systems that might benefit a practice owner, but not benefit the practitioner or not benefit the customer.
Yeah, that's beautiful. I think that's the first response we've had that hasn't been about productivity or output. It's about reducing burnout, which I could imagine in the healthcare industry, and that's something you've worked at for months, is probably one of the biggest blockers for people wanting to leave the industry is because they're just overworked. So it's really exciting that AI can actually change people's lives in such a positive way, especially in an industry that won't go anywhere. We'll always need healthcare. We'll always need to look after ourselves. So the work that you're doing, Darren, I think is really admirable. And I really appreciate you sharing all your expertise today.
Yeah, no, thank you for having me on. Really appreciate the time and the platform. And yeah, if anyone ever wants to reach out to us, I'm available anywhere, anytime.